Lastly, I'll be discussing the risks and side effects of dialysis. One of the more common uh, risks of dialysis is hypotension as well as hypertension. For hypotension, the dialysis machine is regulating the flow at which the blood is coming in and out of the body, and patient could be hypotensive if it's irregularly set and blood is coming out too fast and not going back into the body fast enough. So that is something to definitely keep an eye out for. A patient could be hypertensive though, for the same reasons, but also if the patient consumes too much alcohol or drinks too much fluid, it could lead to the patient being hypertensive. Next, a patient could be anemic. Patient could be anemic, which is a common complication for kidney failure as well as undergoing dialysis. And failing kidneys, it's going to reduce the production of erythropoietin, which stimulates red blood cells. So, between that and potentially not having enough red blood cells in the body to begin with, a patient could be anemic. Next, a patient could also be fluid overloaded. When the patient is on dialysis, the dialysis machine is removing the fluid, but if a patient is drinking too much and still or receiving fluids in the hospital, a patient could become fluid overloaded. Definitely one of the more serious ones, in my opinion, the access site complications. Could be really dangerous. You have a fistula or a graft placed into your arm, and there are side effects such as infection, narrowing, an aneurysm in the blood cell, or the blood vessel wall, or even a blockage. So that is a potential complication for dialysis. Next, a dialysis-related amyloidosis, which develops when proteins in the blood are deposited on joints and tendons, and that is a complication for dialysis. And lastly, for some of the risks and side effects of dialysis, we have pericarditis, and that's going to be insufficient hemodialysis, can lead to inflammation of the membrane surrounding your heart. So with that, it's going to interfere with your heart's pumping blood to the rest of your body. And that is it for my dialysis presentation. Thank you for listening.